You knock on the door and hello, my name is Alan. I'm the nurse today. How are you doing?
Good. Tired.
I am here to do a physical assessment. Is that okay? Then we provide privacy, so we close the curtain and we raise the head of the bed. I mean the bed up to a comfortable position and lower the rail where you are working it. Physical assessment consists in doing a general inspection of the patient by looking to see how the patient is reacting, if the patient is alert, oriented, things that you already grasp from looking at the patient. You're not going to be wondering, is this patient alert, oriented, is this patient awake? Well, the eyes are already open, so yeah, it is awake. Now we're going to find out if the patient is oriented. Can I see your armband, please? Can you give me your name and date of birth?
Victoria Naparella, 7/22/95.
Do you know where you are? Where are you?
At the hospital.
And why are you here?
Because I have pain and I haven't been feeling good and it's constant pain, migraines and all.
Do you know what month is this?
Yes, January.
And how old are you?
22.
Okay. So by asking those questions, you can see that the patient is alert, oriented to self. She knows where she's at and she knows why she's here. So when we say alert oriented times 4, is because the patient is telling you her name,
oriented times 4,
her age, what day, what month it is, and where she is and why she came for. So after that, you proceed to check the head and you do an visual inspection of the head first, looking for spots that have no hair in or loose hair that may be falling. Patients with cancer have very little hair or it looks very frail. And I am going to touch your head. Do you have any bumps? Have you had any falls in the last 3 months? Do you wear any hearing aids? Are you having any hearing difficulty? Do you have any drainage? Any buzzing or ringing on your ears?
Every once in a while.
And you look behind the ear for any signs of pressure ulcers. Then you look at the face and start palpating. Let me know if it hurts, okay?
A little bit right there.
Any headaches?
Yeah, I get migraines.
You have migraine headaches? What about here? Does it hurt?
A little bit, more so in my tummy.
More right here? How often are those headaches?
A couple times a week.
Do you have headache right now?
Not really, no.
Not right now. What about here? Do you have any pain?
A little bit in the eyes.
Do you have sinus problems? You do?
Bad allergies though.
You have bad allergies? Okay. Now you want to look at the symmetry of the eyes. They look symmetric. Then you can ask them, you have any difficulty with your vision? Can you see far? Can you see for reading?
Yeah.
Can you follow my fingers? Now I am going to flash your eyes with the light. What I'm looking for is to see if your pupil reacts to the light, okay? Then I'm going to ask you to follow the pen when I go close and far to see if the pupil accommodates to the distance. Can you please look up to the ceiling for me? Now, can you see? Any discharge? Any pain on your eyes? Do you have any difficulty
Sometimes.
smelling?
Not smelling, maybe breathing.
Breathing? Can you take a deep breath? Again? Any bleeding from your nose? Any problem with your mouth? Any loose teeth or gum problem? Say ah. Are you having any sore throat?
Sometimes I feel like my lymph nodes are swollen sometimes. But I
Sometimes
feel like
they
it's
do.
because my allergies maybe. I don't know.
Difficulty swallowing? Let's see, swallow for me. Okay. Now I'm going to palpate your face to see if there's any nodules or inflamed lymph nodes. Now, when you do a more detailed physical assessment, you want to palpate also the thyroid gland to see if there's any masses or nodules. The thyroid gland is right here, and also the parathyroids, 4 little glands on the side of the thyroid. You assess the supraclavicular area to see if there is also palpating to see if there's any ganglions or inflamed nodes, and also to see if she's having any difficulty breathing. Somebody with difficulty breathing, you will see that this every time she breathes in, it will deepen. You will see a retraction of the muscles that are here, and we call it intraclavicular or accessory muscle being used with every breath. So what I'm gonna do next is listen to your lungs and your heart. Okay? Have you been sick?
No.
Have any cough? Any congestion? Any mucus? Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Deep breath. Deep breath. Now your lungs are clear. I am going to listen to your heart, okay? So to listen to the aortic valve, we're gonna find the second interclavicular space. This is the first, second. On the left side of the sternum, we will place the stethoscope and listen. Then we slide the stethoscope to the left side at the same level and listen for the pulmonary valve. If you want to listen to the Herbert point, you go down to the third space on the left side of the sternum. This is the place where you will hear murmurs or other abnormal heart sounds more strong. And finally, we're gonna check the apical pulse, and the apical pulse will be located on the fifth intercostal space, mid-clavicular nerve. So we trace a imaginary line and we put our stethoscope there. On her, you don't have to actually lift the breast. You can hear it very clearly without lifting the breast and putting the stethoscope in. So first, try to do this. If you cannot hear it, lift the breast a little bit and put the stethoscope in. Okay. Ask the patient if she can sit up. Can you sit up? I'm gonna listen and palpate your back. Let me know if there is any pain points, okay? Does it hurt?
A little bit right here.
Right in here?
Yeah, right here.
Now I'm gonna touch your spine. Let me know if there is any pain when I feel your spine.
Right there?
It hurts right here? It hurts more?
Yeah.
What about here?
A little bit. No.
When you do this, you're also looking for alignment of the spine. You want to make sure that you document if the patient has deviated spine or if the spine is in alignment. So when you palpate, you want to percuss. You start with the upper, just the same as auscultating. Any pain when I percuss on you? No? And then finally you're gonna listen to the lungs. What we're trying to find out is if the patient has normal sounds or if the patient has wheezing, rails, or any adventitious sounds, okay? Take a deep breath for me. Take a deep breath. Take a deep breath. Deep breath. Okay, thank you. You want to come back here. So next we're going to check her extremities. Can you raise your arm for me? Is that the highest? Can you touch your hair? Now with your left hand. Touch your hair. Okay. Now we're gonna bend your elbow. Now your wrist. The other hand. Then you wanna feel for a radial pulse. And capillary refill. Now I'm going to check your abdomen. Are you having any diarrhea or constipation? You having any abdominal pain? No? When was your last menstrual period?
3 weeks ago.
When?
3 weeks ago.
3 weeks ago. Remember, abdomen, we listen to bowel sounds before we touch. And we divide the abdomen in 4 quadrants.
Peristalsis.
So we check for peristalsis on the right lower quadrant first. And then right upper quadrant. Left upper quadrant. Left lower quadrant. Your bowel sounds are active in the 4 quadrants. Now I'm gonna palpate to feel for any masses, or let me know if there's any pain at any point, okay? Take a deep breath. Is there any pain? A little bit? Is there any pain?
Just slight, a little, not much.
Not
A little tenderness.
tender? All over or only on this section? On this,
A little bit on here too.
on that side too?
Right.
Then you do your percussion. At the same time, you also ask, when did you go to the bathroom last?
2 hours ago.
Do you feel any distension? Do you need to go to the bathroom now, or
Yeah,
you can
probably
wait until we
I can
finish?
wait.
Okay. Any problems with your urine?
No.
Can you hold it to go to the bathroom, or you have incontinence?
No.
You can go to the bathroom, no problem. You don't wear any sanitary napkins or anything? Even when you laugh or when you... Okay. Now, you proceed with the lower extremities. Before that, we do the hand strength. I was forgetting that. So can you squeeze my fingers, please? Now we inspect the legs, and we want to see the color of the skin, the temperature, and if there's any fluid retention or swelling. A lot of times the swelling is only manifested on the ankles, so we want to remove the socks to see the whole picture.
We all did it too. You're okay.
No, we didn't take off the socks.
Then you want to feel for fetal pulses.
Fetal pulses.
Fetal pulses are on top of the
foot.
foot. And you want to do the capillary refill.
On each toe?
You do it on each toe if the patient has a problem with one or two toes.
Oh, okay.
But if there is no problem, like you can see here, you can only do it on one, and that will be good enough.
Okay.
And if the foot is warm or cold, always compare one side with the other one.
Question, Alan.
You can also check for popliteal pulses.
Popliteal pulses.
I'm gonna avoid for you.
Femoral pulses. Okay.
Can you bend your knee for me? Straight, extend it. The other one. Extend it. You move your foot back for me. Push. Push. Do you have any pain on your calf? No? On your what?
In your calf.
On your calf. Right here. Again. Push. Do you have any pain on your calf? A little bit of this one. When there is a little bit of pain there, we want to inspect to see if there is any redness and feel to see if there's any hot or is warmer than this side.
Oh, okay.
Those are the signs of deep vein thrombosis.
Positive Holman sign.
Because the red area blanches when you touch it, it turns white and then red again.
Okay.
If it doesn't blanch and it stays red all the time, that will be a stage 1.
Stage 1.
So you inspect the heels and the shoulders, the elbows, the back of the ears, the back of the head, and the sacrum, the hip, and right at the gluteal fold. Those are the major pressure points that we want to see if there is any sign of the cubitus ulcer.
Cubitus ulcer.
This part. Okay. Thank you. Let them know that the call light is there if they need anything.
Yeah.
And before you leave, ask them if there's anything else I can do for you.
Okay.
No, thank you. Okay. Take your gloves off. Do hand hygiene. And out you go.
Okay.
Thank